Welcome back to Vitality. It's Dr. Melissa McCrae, and I just wanted to go over a couple of thoughts that I've been collecting over the past couple of days. Everything seems to be changing so rapidly, so I really think it's prudent to make sure that we can pass along the best information for all of our patients. Just that general knowledge, the more that people know, the more they're armed with factual information, then the better off we're all going to be. So my top 4 thoughts today regarding COVID-19. We've heard a lot about diabetics and hypertensive patients or heart disease patients really having a lot of issues with COVID-19 and an increased incidence of severity of COVID infections. That doesn't mean that everybody who is a severe diabetic who gets COVID actually dies from it. However, they get a lot sicker. So what I wanted to do is make sure everyone was empowered. Diet and exercise can do tremendous things for blood sugar control. When your blood sugar is high, it kills your immunity. So we need everyone's immune systems to be nice and strong. Do not be fooled by how much impact you can have by changing some simple things in your diet and just movement. Now, we're not talking about, you don't have to do hour-long workouts. It's simple movement can make dramatic changes in your blood sugar. So start now. It's a perfect time. These are factors that you can actually control on your own, so that's so important. If you're not sure about what changes to make, certainly reach out to your providers. They're more than happy to give you information on how diet and just movement-based factors can actually have a significant impact on how you're doing. So be aggressive with those changes. The second thing we're hearing a lot about is ACE inhibitors and ARBs. Now that's two categories of medications. I call them cousins. They're very closely related to each other. Very, very common medications. First line for blood pressure, also very protective of kidneys in high blood pressure patients and diabetes. So we'll have lots of people on ACE inhibitors in particular. If you get a dry, nagging cough with an ACE inhibitor, you might be migrated over to an ARB, or an angiotensin receptor blocker. What we're finding is people who are on those medications, because of the mechanism of action, it actually makes the coronavirus love to attach there. So there's a much that coronavirus loves the cell when the mechanism of action has kicked into place for those two categories of medicine. There was some thought, should we change all these people off of those medications to make them less susceptible? What the current recommendations are by the American College of Cardiology and even the World Health Organization is do not do that. So we think that the risk or the benefits definitely outweigh the risk in changing blood pressure medications. If, however, you have uncontrolled issues with your blood pressure, if you're not doing well on those, it's important to talk to your provider. There might be some reason in there why it might make sense for you to change. But current recommendations are, although we're hearing a lot about it, current recommendations are to stay where you're at on those two medications. The third thing that also has been a hot topic on Facebook and social media and Instagram is ibuprofen. So we call the category of medicine that ibuprofen is in non-steroidal anti-inflammatory drugs. NSAIDs is what you might have heard. So we know that NSAIDs actually do have a significant effect on coronavirus in a very bad way. So it tends to increase the severity of a coronavirus infection, specifically the COVID-19. So it is really important. Avoid non-steroidal anti-inflammatories as much as you can. If you have concerns about that, call your provider. Now, what is an NSAID that's commonly out there? Ibuprofen, Motrin, Advil, Aleve, meloxicam. If you're on any of those medications, please reach out to your provider. If you can stop them, stop them. Now, the fourth thing is some really great news. I just love this because finally we get to hear some really good things. We're finding that infants are almost never affected by coronavirus or COVID-19. So even when a mother is actually positive, there has only been one documented case of an infant who has gotten COVID-19. It was a mild disease course and they recovered completely. So I think in all of it, that's a really wonderful thing. It's great to be able to offer some reassurance to our pregnant mamas out there. Certainly we want to protect ourselves, protect your family. Social isolation is really important because there's nothing better for a baby than a healthy mom. So from that regard, we want to protect the moms, but it is so reassuring to hear that the babies seem to do just fine. So there's a lot of evolving information out there. A lot of people have called in with questions, have shot us messages through our patient portal. we want to make sure that we're able to address the concerns that people have and be able to pass along structured information. So we've actually created something called a critical access visit. This critical access visit is a brief medical visit with one of our providers. You'll be able to ask all the kinds of questions you're interested in. How are the specific medications that you're on affecting things? Should you get tested? Where should you go get tested? Do the symptoms you have actually fit with something? Should you go get certain testing? Should you go to certain appointments? So we're happy to be a resource for that. You can certainly reach out to the office and we'll help you with those very personalized medical decisions and very personalized medical information. The Ohio Department of Health also has some wonderful sites linked on their site. So the World Health Organization, the CDC, National Institutes of Health. You can find all those links on Ohio Department of Health website. So there's lots of places you can go for factual information. To do that. If you have any other questions, please don't hesitate to reach out, and we're going to continue giving you some good info along the way. Most importantly, do those common basic precautions. Wash your hands, don't touch your face, try to take a deep breath, and it's all going to be okay.